How to get off of testosterone naturally. Most patients are really scared of getting on testosterone because do I have to stay on this forever? So actually weaning somebody off of testosterone, if you're taking 100 milligrams a week, 200 milligrams a week of testosterone, you're actually gonna use HCG and Clomiphene, which is Clomid. HCG and Clomid will stimulate your testicles or your gonads to create more natural endogenous production of testosterone, which will counteract what testosterone does. You have a negative feedback loop. If you actually inject an exogenous form of testosterone, you're actually gonna have a negative feedback loop. You're actually gonna decrease your natural or endogenous production of testosterone. So how you counteract that? HCG, Clomiphene, or Clomid. So typically I tell patients to use it 3 times a week, 4 times a week, even sometimes every day to kind of counteract that negative feedback loop of taking exogenous testosterone. So if you're having troubles with getting off of testosterone or you're scared of getting off of testosterone because it's actually going to tank your energy, tank your libido, and you're actually going to feel worse while not taking testosterone, contact me and there's a couple different strategies of how to wean you off.